Okay, good afternoon, everyone. This is the Public Health Day Montgomery County board meeting, and it is December the 16th, I believe, 2020. And good Lord willing, it's going to be our last meeting of the year. So we're probably thankful for that. And without further ado, we'll kind of ask Faith to do a roll call, if you would, please.
Dr. Block.
Present.
Mr. Downing.
Here.
Ms. Meadows.
Present.
Dr. Orlowski.
Here.
Mr. Orr. Dr. Rhodes.
Present.
And Mr. Sims.
Yes, I'm here. Thank you, present. Appreciate it. So is it possible, I'm going to kind of throw a curve at somebody here, but is it possible to put up on the screen the agenda?
Sure.
Sure.
Jeff, do you want me to try? Or
Just the, just the,
I will.
Or I'll do
Yeah,
it.
hold on just a second. Are you going to do it, Jeff?
Sure. Here we go. Let me share my screen. Whew, this is dangerous.
we've all entered uncharted territories and we've.
All right, can everyone see that?
Yep. Yeah, that's great.
No, that's not the final one.
Oh, that's the interim. I don't have the final one.
Well, you're not, we need the real boss. Faith, can you
Intervene. That's not it. All right, I'm gonna stop share.
Hold on. Okay. Let's see.
Oh, hold on. Hold on.
I got it.
Here we go.
You got it?
Yes.
Okay.
Share screen. Oh, that's it. Revise.
Wasn't going to say.
No. Where'd it go? Well, you may have to have it. It's not. Oh, there, I got it. Okay. Let's go back up to the top.
There we go.
No, that's not it. I don't have it. I give up.
Okay.
I don't have it.
Hold on. I got it. Hold on.
Yeah.
Okay, so let me go back to. How's that?
There you go. You got
Okay.
it.
Thank you.
Mm-hmm.
Okay. So let's go to, are there any items that were presented today that any board members feel like could be a conflict of interest and need to abstain from? Okay. Hearing none, let's go to the Office of Administration. There were 3 items that are presented.
So move.
We've got a motion. Do we have a second?
Second.
Second. Okay. Is there anyone who needs a discussion about any of the 3 items that were presented? Okay, hearing none. All those in favor signify by saying aye.
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 Opposed, same sign. Approved as presented. Office of Environmental Health has 1 item for consideration today. I need a motion.
So moved.
Second.
Moved and properly second. Discussion about the item. Jeff, is there anything here that's of concern from a board perspective? Or?
No.
Okay. All right. All those in favor signify by saying aye.
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 Opposed, same sign. Approved as presented. Office of Health Promotion, there's one item for consideration. I need a motion.
So moved.
Second.
Moved and seconded. Discussion about the item. All in favor signify by saying aye.
Aye.
Opposed, same sign. Approved as presented. Office of Health Commissioner has one item for consideration. Need a motion?
So moved. Second.
Second.
Moved and properly second. Discussion about the item. Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Approved as presented. Okay, Jeff, do you want me to open the floor up, see if there's anybody has anything, or do you want to kind of talk about a couple things that you want to present besides what's on the agenda?
So we'll certainly, if the board members wanted to ask questions, that's fine. We had a couple of items we wanted to share with the board and make sure you're aware of how we intend to move forward. So I'll leave it up to your preference, how you want to do this.
Okay, well, let's start with, does anyone, I think Jeff's going to talk about the vaccine and the protocols and all that. So if people have questions about that, maybe hold those until he gets a shot at trying to present his facts. See if there's any questions from the group. Okay, hearing none. Faith, I'm assuming no one's requested to present anything to the board?
No.
Okay. All right. So Jeff, I'll turn it back over to you then.
All right, thank you, Mr. Sims. Faith, could you stop sharing your screen for a moment to where I can do that? Thank you. Well, first of all, thank you for approving the resolution to extend the stay-at-home health advisory. Governor DeWine and the Ohio Department of Health extended the statewide stay-at-home tonight order last week through January 2nd. We were in communication with all of the other health departments around the state that had previous health advisory, stay-at-home health advisories like we had. They were all expiring on December 17th, and we all agreed to move forward and align with the stay-at-home tonight order to where all of the urban, it's my understanding, all of the urban health departments across the state are extending their health advisories to January 2nd as well. And it's very much needed based on the continued spread of the virus. I'm going to share my screen real quickly. Okay, can you see that?
Yep.
Okay.
Yes.
So the state of Ohio has, and the director of the Ohio Department of Health have issued these 10 protocols for staying safe through the holiday season, so extending through January 2nd. And these are messages, these top 10 are messages that we've been giving from day one, essentially as more and more information became known about how this virus spreads. And so these protocols are really needed to make sure that we continue to slow the spread of this virus. Certainly the work that we've been doing as a health department and as a community is phenomenal. I'm very thankful for the work that our employees are doing to do our part to limit the spread. If you think about what we've accomplished this past year, and we shared this with in our town hall meeting with all employees this morning. Keep in mind, we have 50 plus programs and services that we offer in our community. And so that continuity of operations planning has been ongoing from the very beginning of this pandemic. So we continue to provide those essential programs and services to our citizens, despite the fact that we're also trying to manage this pandemic. And then with respect to our pandemic response activities, we've been, as you're aware, we've been doing a tremendous amount of education and outreach to inform our community. All of our case investigation and contact tracing work, our community pop-up testing, operating our call center and information line, all of the environmental work that we're doing around addressing complaints and providing guidance to businesses and doing compliance checks. We continue to update our epidemiological data on a weekly basis and provide that to our community. All of the logistic work that goes into being able to do all of those actions and all the behind the scenes information technology that needs to be in place. It's truly been a team effort on behalf of this agency. So we're going to continue moving forward into 2021 with all of those routine programs and services, continue to the extent possible all of our current actions around managing this pandemic. And now we have one additional task to do, and that is a mass vaccination program. So certainly our employees need to be recognized, and we try to tell them every single day how phenomenal they are in terms of being able to provide these services to our community. I'm going to quickly share. I'm going to scroll down this document. I don't want anybody to get dizzy as I'm doing that. Here's the initial information we received from the Ohio Department of Health in terms of phase 1A groups that are going to initially receive the vaccine. And so when you look at that, there have been a few more bullets added to that chart by the state. And so just preliminarily, we estimate somewhere between 50 to 60,000 individuals within Montgomery County are going to fall within phase 1A. And so the message we gave to our employees today is we will very likely be doing vaccinations most of 2021, the rest of this year and most of 2021, because this is just phase 1A. Then there's a phase 1B, phase 1C, and then on to phases 2, 3, and 4.
Excuse me, Jeff.
Yep.
How many did you say were estimated to be in phase 1A? How many people?
Somewhere 50 to 60,000. That might be an underestimate.
Thank you.
Yep. So I'm going to stop that screen share and I'm going to go to another document. All right, and we received this document this morning. Well, actually, apparently this document went out last night, and Barb, Mickey, Larry, and Janine and I were trying to review this document last night. Janine was able to see it by using Google Chrome on her desktop, but the rest of us on the same link could not access it. So we're not really sure what happened there. But in any event, here's the guidance we've just received from the Ohio Department of Health on the role that public health, local health departments will play for phase 1A. So if I go back up, congregate care and health care providers in phase 1A. So when you start looking at all of these groups, and we'll send this document to you to where you have it for your records. People to be vaccinated in congregate care facilities include residents and staff of nursing homes. Obviously, if they're enrolled in the pharmacy program, they'll be covered by pharmacies. But those who are not within the federal pharmacy partnership program, public health will have responsibility for. We think that's a small number. But then individuals with developmental disabilities, mental health disorders, group homes, et cetera, we will have that responsibility, as well as those entities. So we are going through a process right now of trying to develop and agree upon a risk-based matrix where we would begin to prioritize how we administer this vaccine as we receive our allocations. So 50 to 60,000 individuals in phase 1A. We know our first allocation of vaccine that we will receive next week is somewhere a little over 3,000 doses. So clearly we're going to need to prioritize how we administer this vaccine. We'd like that to be done consistently throughout our 8-county West Central Ohio region by those health departments. And then I'm communicating with the large urban health departments across the state to see if we can get consensus around how we're going to all move forward and prioritize these groups. But this is going to be a multiple month process just to get through phase 1A. Dr. Doan, any comments you want to make on prioritization of these groups?
Jeff, I have a question for you.
Sure.
Just in terms of, is your nursing division primarily the ones or the clinics that'll be doing the vaccinations?
I'm not, so ask that again, Mrs. Meadows.
I just wanted to know who's taking the, in terms of who will be providing the vaccinations. Is that the clinic staff or your nursing? How are you doing?
Yeah, so we will have public health vaccinators that are going to be administering the vaccine at what we set up as we call points of dispensing.
Okay, and does that require additional training for them?
I don't believe so. Janine, do you want to, or Mickey, do you want to cover that? Janine on the call?
I can try. I think Janine would be better, but I can try. This is Mickey. The vaccine pods are going to take a certain amount of training, not specifically for COVID, but just on how to run the pod and how the movement of people are going to go through it, and what the different tasks are going to be, so that there will be just-in-time training to help everybody that's going to staff the different pods to be able to do their job, and so that we're all working from the same model and blueprint. As far as the vaccinators go, I mean, there's nothing particularly different about this vaccine than others. And so I think that, you know, our licensed professionals that will be giving the vaccine, it should not be anything that they're not accustomed to.
Thank you.
We do know that to open a point of dispensing, we'll have multiple employees involved in that, similar to the way we did it in 2009 with the H1N1 pandemic. So we'll have to stage people, make sure they're social distanced, greet people, triage them, go through registration, go through screening, vaccination, monitor them for 15 minutes for any adverse reactions. We'll have a sick room, and then paper processing, all that. So it's a pretty extensive undertaking, but it's something that public health knows how to do. Now, granted, some of the locations that we will be responsible for, especially, for example, Stillwater Center, and or some of the Department of, or the Montgomery County Department of Developmental Disabilities, some of their clients that they serve, it may not be practical for them to come to a point of dispensing. So we'll have to figure out how we get to them.
Right. Okay. Thank you.
So we've informed all of our employees that unless it's specifically prohibited by a federal or state grant, that we're all going to need to work at these points of dispensing as we set them up. So as we begin to receive vaccine on a weekly basis, it may be that we open at minimum 1, potentially 2 points of dispensing per week to be able to get this vaccine into the community. We certainly cannot be, we never want to hold the vaccine or not be able to get it out to individuals in need.
Right.
I'll stop that screen share for now. There was one other document I was going to share with you. I'm amazed at how I'm able to navigate this screen sharing now.
Come a long way.
Yeah, I know. Good heavens. So we're sending out a survey to gauge attitudes about vaccine. Tara, do you want to walk through this since it's mostly your group and staff that have put this together? Or how would you want to proceed?
No, you can go ahead, Jeff.
Oh, thanks.
Sure.
Chicken.
She's in the Christmas spirit. She's giving it to you.
Well, I don't need to be the only one talking here. Does anybody else want to walk through it? No. We'll send this survey to you, but it's really intended to start understanding what may be major barriers or concerns about individuals receiving the vaccine. So, for example,
Jeff, before you get into the question, just the logistics. I mean, who are you reaching out to? How are you doing it? How are you trying to get feedback from those who? Well, I'll just kind of stop there and let you answer my first couple of questions.
so that we're going to require Director Williams to answer.
So I'll jump in there. First of all, it's been sent out to all of our employees within the health department. We're sending it out to all of our coalition members, task members, and community members. We've also have Gadaha, who's working on this committee with us. Gadaha is sending it out to all the hospital systems, and we're asking that each of our coalition members send it out to their email distribution as well. It will be posted on all of our social media pages. It will be posted on Gadaha's social media pages as well.
So there are a variety of questions where we want to get information.
Is it pretty lengthy?
It's about 10 questions,
Yeah.
Mr. Sims. It's not very lengthy. The overall gist is that we want to make sure that we are addressing the concerns of healthcare workers and community individuals at large. And we want to make sure that everyone knows that the vaccine is safe, the efficacy of it. And if there are any barriers to getting the vaccination, we want to make sure that we're able to address that as a health department. So this is helping us address our messaging around the vaccination as a whole, as it relates to overall population within Montgomery County.
Yeah. So we'll send you the link to the survey to where you have it.
Okay. Okay, that's good. Okay, Jeff, were those the two things additional that you wanted to cover today?
Yes, Mr. Sims.
Okay. Okay.
Can I ask a question just for my own understanding? So that first group that you were talking about, so if someone lives in congregate living, like an assisted living facility or something like that, so who, the person, I'm just kind of confused on, so you said that public health will have a responsibility for some of the residents, but then dependent upon their enrollment in other programs or insurance. So like multiple agencies could be coming into one congregate care setting to do the vaccines. Is that correct?
I don't believe we'll have multiple agencies at one setting. We do know that for nursing homes and other long-term care facilities that are part of the national or the federal pharmacy partnership program, pharmacies will actually be going into those facilities to do the vaccination of staff and residents. It's just those congregate locations that aren't part of the federal partnership program, then public health is going to need to absorb that responsibility for giving the vaccinations.
Thank you.
Yep.
Okay.
And we want to make sure that we're aligned with our, I mean, there are a lot of moving parts here, and we want to make sure that we can inform our community of how this is going to unfold and that we're aligned with everyone in Montgomery County who's going to be doing vaccinations. So we need to make sure we move forward and do this planning in partnership with our hospital systems.
Do you have an estimate, since you brought that up, about how many agencies will be doing vaccinations?
Oh, I don't know that I have that offhand.
That's okay. I was just curious because
Or even pharmacies. Which pharmacies?
So CVS and Walgreens are the pharmacies locally that are going to be doing this, administering the vaccine.
Would you anticipate people in that 1A group be able to walk into a CVS or a Walgreens and get a vaccination?
I don't think I'm not sure how the pharmacy program is going to unfold. I think it I mean, ultimately down the road that may happen, but right now I think they're going to be going into nursing homes to do it and long-term care facilities. I don't see people going to a pharmacy to get the vaccine right now.
You got 300 dental offices around Montgomery County, plus staff. How are they?
Jeff, I think you had
May not be able to answer that.
You kind of had a prioritization there, didn't you? Wasn't that part of the list?
Well, so I'll share my screen again. What we will need to do, oh, I may have closed that document. Hold on. Let me open it back up. All right. See if I can find it again. There we go. So these are the groups.
So can you just kind of go back up a little bit to the first indentation? There you go. So 1A, so those individuals, I mean, you're going to be going to them, right? Isn't that
we
what
would have to go. And I think this group, nursing homes and assisted living facilities not enrolled, I think that's going to be a pretty small group.
Right.
This is going to be a much larger group.
Right.
And then ultimately all of these, but we need to be able to prioritize. We can't do all of these at once, including we've informed our employees today that not all public health employees, even if you're working at a point of dispensing, are initially going to receive the vaccine, because I think the optics on that in the community would not be good if we vaccinate all of our employees but not move forward with these other groups. So
yeah, are these in any particular order, or they're just aggregated into one group?
these are just aggregated right now. That's what we're going to move
It
forward.
says in no specific priority order.
Yeah.
These are not a priority order right now. That's what we will try to get in place by the end of this week.
Do you expect, Jeff, that the other counties will collaborate and do that, or is it going to be helter-skelter?
Well, our hope is that it's not the way it was when we identified essential versus non-essential businesses, and we had to have a dispute resolution panel established at the state because it was so inconsistent in terms of how it was being done across each county health department. I don't know the answer. I can just share that this region, our 8-county region, has a long history of doing things together and being consistent in how we do it. So I'm very optimistic that our West Central Ohio region will align. And my hope is that we can align with all of the other urban large health departments across the state.
Okay.
This is Mickey, if I might make a comment.
Sure.
I think, you know, the Southwestern Ohio region has a list of 26 distinct categories of locations, groups within 1A, and a 27th, or, you know, a 27th category, which is other. And so I think that, you know, trying to parse out at this point, when we haven't received any vaccine yet, exactly how that's going to roll out is going to be very difficult, as you might imagine. And it's really, to some extent, it's going to depend on what vaccine we get and when, and how we can best go about trying to figure this out. And there's guidance about what works best. This is really, you know, this is a entire population pan-vaccination plan, but it's not being rolled out that way. It's being rolled out as a series of sequential targeted limited vaccinations within groups. And so there's information about how you make those choices, and we're trying to apply that information to what might be done. And, you know, to some extent with, you know, we talk about herd immunity. Well, that can be applied to subgroups. And so, you know, considerations of how, you know, what subgroup might we be able to attain herd immunity and kind of have that group taken care of for a bit. What are the purposes of vaccination? We think of it, of course, as to protect the individual from infection, but in fact, influenza vaccine is primarily in healthcare settings given to protect the patients, not to necessarily protect the healthcare worker, because we don't want it to spread. The other consideration in the case of the coronavirus is we want to give vaccine to people in order to protect the public health and safety, such that the EMS services can continue, such that police and fire can continue, et cetera. So that there are different goals here. And I think that we're going to be looking at prioritizations that people are going to spin out based on the group characteristics, both how big the group is, as well as what's the risk of that group having real problems if they get infected, thus the long-term care facility people, and are the reasons to vaccinate simply to protect the person, or are there other reasons as well that would make them a higher priority because there's additional benefit to us by vaccinating those people. I don't know if that's helpful or not, but that's the sort of way that I am thinking about it at this point.
I think that helps. And Jeff, I think you kind of made mention, but I think you're going to try to have interaction with the healthcare systems in the area to kind of try to coordinate a consistent rollout and
Yes.
Okay. Okay. Anything else around that important subject?
No.
Dr. Rose, I kind of got out of sync today, and I apologize. But
Yes, I am offended, but
you haven't been totally ignored. I just saved the best for last.
well, I like that. Today is a very important day, especially for me and all chocolate lovers. Today is chocolate covered anything day. So if you like chocolate, today's your day. Tomorrow is Wright Brothers Day, and being a Dayton resident, of course, we've all got a tie-in with the Wright brothers. But Friday, and I want our commissioner to hear this because he's in a unique position to really make an influence here. Friday is Ugly Christmas Sweater Day, and that is an official national holiday. And hopefully we'll have all our public employees properly attired.
Yep.
So we just notified our Employee Activities Committee just yesterday. We sent an email to all employees. We have a competition for the most bizarre mask and sweater. When does it start?
Friday.
Friday.
And so when does ours start internally? Barb, do you know when ours starts internally?
Yeah, it actually starts now, Jeff. So
Okay.
anyone can start sending, because we're virtual, so individuals can start sending pictures in at any time.
Nice. There you go.
I used to know these chemical equations. I have no idea anymore.
Oh, wow.
I can identify water. That's it. Maybe a benzene ring, but other than that,
Salt.
yeah.
Yeah. Cute. Neat. Well, that's good. This time a challenge, anything that's fun and creative is probably important for the mind and the soul. So Dr. Rhodes, thanks for your sharing of
Anything to help the cause.
Yeah. Okay. Anybody have anything else they wish to bring up today? Okay. Well, Pat, continued recovery to you, and if you need us, just reach out to us. We're here to help you. Okay.
Thank you very much. I appreciate it.
Eat some chocolate.
Been doing that too much.
Okay. Everybody have a great Christmas and New Year, and we'll be back together the first Wednesday in January. Faith, again, thanks for all your help.
Stay safe.
Happy holidays.
Happy holidays.
Happy holidays. Take care, everybody.
Thanks.
Bye.